Hi, I'm Devin Garza. I'm with Renaissance Women's Group, and I wanted to give you kind of an informal discussion about what to expect from the discussion about having Essures present in your body, and what it might look like to have an evaluation and a surgical removal of those Essures, or whether or not you want to have something more definitive done, which could be consideration for you depending on other symptoms that you have. So when it comes to the Essure product, obviously millions and millions of those went in, and well-intentioned surgeon, even myself, were kind of believing that these were going to be perfectly benign and a non-issue and a wonderful way to avoid a more complex type of a surgical approach. So I stopped doing them a long time ago when we started having even the hint that there might be an issue with those and some long-lasting effects. So without getting into a lot of the potential long-term side effects that you may be having, the most common ones being pelvic pain, there are other ones that are more systemic that I know not everybody believes could be coming from the Essures, but I think we've seen enough evidence to support that there probably is. So in either case, if you're considering having those removed, then there's always the consideration for how that gets done. And so my specialty is being very highly experienced with the robotic platform called Da Vinci, and I've done, 1,800 procedures. I do mostly complex work. And the application of the robotic platform for removal of Essures is in my mind, perfect application for use of a product that gives me better visualization and much more dexterity, whereas my hands are pretty normal size. I work in an area about this big with wrists, and that's about the size of a volleyball. And that translates to little bitty instruments with much better vision, 3D, HD, vision. And then that little bitty instrument does exactly what my hand does. So the same movements I'm doing here translates to the size of about a golf ball with microsurgical depth of field. So we're able essentially to do more complex work and more precise work through those itty bitty incisions called minimally invasive laparoscopic incisions. So all that being said, the ability to remove your Essures, if they were placed correctly to begin with, is a relatively simple thing to do in my hands. Of course, I do much more complicated work most of the time. So that's absolutely a good possibility. There's some other things to keep in mind, and that is the day of surgery is going to take some degree of time just to have anesthesia discussions with the anesthesiologist, to have the potential for maybe some lab done either beforehand or the day of surgery, and then the healing process. First of all, the procedure itself probably will take me no more than about half an hour or way less than that, again, depending on whether or not they were placed appropriately. And that's just to have the product removed. Would like to do an x-ray to make sure the complete coil is removed. I think that not doing that can lead to having very few people, but some people are going to have some residual coil left in, and we don't want that. So that would be something that I would do in addition. Also, many times I'm going to ask to have that x-ray done ahead of time so that we know that those coils are actually in the right place and I'm not faced with a big surprise once I get inside the abdomen. I'm fully able to manage those surprises, don't worry, but I want to have the ability for you and I to have the discussion that there may be something else that has to be done. Now, some folks after the surgery are going to do perfectly well. Most people will, of course, and they'll probably go home within about an hour or so. Some folks, don't react well to anesthesia or whatnot. I don't anticipate that there's going to be any type of complication. That would be extremely rare and uncommon in my hands and with my experience, but we never say that there's no risk involved with surgery. So if all things go perfectly well, which they should, and that's my expectation for you, then I would anticipate you being able to go home roughly an hour after we're done, 2 hours maybe, depending on how you recover from the anesthesia. Now, switching gears a little bit, some patients don't want more kids, and they have just miserable other symptoms. And those other symptoms may or may not be related to the Essure. Endometriosis is another something that I take care of quite a bit on a referral basis. And potential for fibroids may be there, potential for heavy bleeding. And I just can't guarantee you that removal of your coils will manage all of those other symptoms. And so that discussion ahead of time is super important. And to be frank with you, a lot of patients don't want to have a concern for failure that removal of the Essures will manage certain conditions, such as miserable incapacitating pain with your menstrual cycle, which has other reasons for potentially having that. I mentioned a couple. And they opt for hysterectomy. What I'm not saying is a hysterectomy is the only thing that you should choose. I make a living out of giving patients options to hysterectomy or to manage their hysterectomy, which may be very complex, through little bitty incisions so that they can get the benefit of a very quick recovery. So I have a lot of, kind of arrows in my quiver, or a lot of options that I can offer you depending on what your needs are, for sure. But those are discussions that we need to have. And if you're from out of town, hopefully we can do that over the phone, because I can kind of help lead that discussion and listen to you and what you have, your biggest concerns are, for sure. If you're live relatively close to Austin, I certainly get patients from all over the U.S. and certainly from all over Texas, who I prefer to sit and talk to you about all of these concerns and give you the face-to-face discussion and look at your face and see what may be causing you some of the most concerning symptoms and issues, and then help you through those discussions. So in-person, face-to-face is always better, but I understand there's logistical issues and we may not be able to do that. That's okay. I can usually get to the majority of those things on the phone with you. So pre-operatively, there's going to be, in my mind, I want to keep you safe. So there's going to be a desire on my end to make you as comfortable as possible and make me as comfortable as possible that you have, that you're healthy. So pre-operative clearance from your own family doctor and blood work for any surgery, there's some degree of consistency with what we want. And your doctor will know those things. I'll also be able to help you. My staff will be able to help you with what we need ahead of time, and then what we can kind of not need specifically to have, but we want to not stray from standardization. So the things that keep my patients on a routine basis at a very high volume, 10 to 20 times the volume of most gynecology surgeons for many, many years now, is a standardization process where I just don't cut corners, and I dot my I's and cross my T's and all that. And so I don't want to short circuit what has worked really well for me to keep my patients safe for many, many years. So there will be some discussion about that type of thing, but we do want to streamline it for you and make it something that's accessible to you to help you get to feeling better as quickly as we possibly can. So with this kind of brief, long-winded introduction to the process and to this, the way that I think through these type of problems, I want to make sure that you're going to be able to have all your questions answered. My staff will be very well versed in things, insurance or cash pay basis. My nurses are extremely well versed in a lot of the clinical aspect. But if you feel like certain things are falling through the cracks, I'm happy to give you a call back. That's not a big deal. Any other things that I can help you with? There will be other consent type videos, etc. I think that my patients have routinely found extremely helpful, because when you're with me in the office, frequently you don't hear everything that I want you to hear because you're thinking of other things you want to make sure you ask me. And so this gives you a way of having to relax, just kind of watch the video and see things that I find very important that you may find very helpful. And it prompts you to have other questions as well. So with that being said, I think that gives us a good running start to what I think is going to be a very safe either Essure removal or removal of the Essures along with the fallopian tube is always an option. Removal of those fallopian tubes frankly means that your risk of ovarian cancer will be reduced by about 65%, is what our literature tells us. So removal of your tubes with your coils is typically how we would manage this. If you are hoping to have the Essures removed and have your fallopian tubes re-implanted to a difficult re-implantation process, we can talk about that, but your chances of becoming pregnant after that are nowhere near what they would have been if you had never had those Essures placed. It's not 0%, but it's in a very small percentage range, maybe 5%, maybe 5 to 10%. But the risk of an ectopic pregnancy, if you chose to do that, meaning the pregnancy never gets past the fallopian tube, would be very high. And so it would be very high risk for you to be followed carefully. And so as long as you know that, doable, but not what I would advise. So not advisable, but I'm in the business of helping women to be able to get those very small odds and do the best we can with that. So I value your value system on that particular thing. Hopefully that helps us get to a running start on questions on your end and gives you some idea. You certainly will be easily directed to my website, devingarzamd.com, and that'll give you a lot more insight into my background, how I do things and what I do on a routine basis, and hopefully I'll be able to make you a whole lot better. That's all for now. Thanks for listening.